Hi everyone, welcome back to another episode of Ask Dr. Nick. My name is Dr. Nick Schmidlkoffer and I work for the Neurologic Wellness Institute. Today we are going to answer the question, how does physical activity and dual tasking or cognition, how does physical activity and cognition training help people with Alzheimer's disease? And this is a really good one, and it's a really good paper that we're going to discuss because Alzheimer's disease is a very common condition. And if most people either know of somebody or are experiencing themselves somebody right now that are dealing with Alzheimer's disease or cognitive decline. And so I want to discuss this paper and how we can use athletic performance, we can use physical rehab, physical training to stimulate the brain in combination with dual task or cognitive training. By combining the two of cognition and physical rehab, we can really mesh them together and um, make it a much better and more robust training effort to improve the symptoms of Alzheimer's disease. And that's because the sensory motor system, the physical system, is more like a bottom up stimulation, while the cognition is a top down, brain down stimulation. Both are needed for the um, both are needed to improve Alzheimer's to the best quality. So let's discuss this paper here. It is a brand new paper, relatively brand new, I guess, from Frontiers in Aging Neuroscience. It was published on December 22nd, 2020. And it's a clinical trial showing that dual task training, so cognitive training with physical training, can affect cognitive and physical performances and the brain oscillation ratio of patients with Alzheimer's disease. So it's a randomized controlled clinical trial. So therefore, there was a group of people that both groups had Alzheimer's. One group of people went through the physical cognitive training. The other one was the control. So they did 12 weeks of this dual task training, looked at the physical performance and brain oscillation of patients on Alzheimer's. The the training included muscle endurance, balance, flexibility, aerobic exercises with eyes both closed and open. They also did an EEG or electroencephalogram that was able to look at the brain oscillation ratios, especially they looked at theta and alpha. And what they saw was there was a significant improvement after training protocol in cognitive function, particularly in the short-term and working memory, attention, and executive function. There was also improvements in depression status, aerobic fitness, like the 6-minute walking test they did, flexibility, functional ability, like chair standing, timed up and go test, strength with knee extensions, bicep curls, and hand grip, which have all been shown, especially hand grip, have been shown to look um, at morbidity and mortality or a better functioning later in life. And they also saw an increase in the frequency of brain oscillation and a decrease in the theta alpha ratio. So real quick on this, the theta alpha ratio, so there are 5 different brain waves that we see in the brain from slow to fast. Theta is one of the slower ones. Alpha is like the in the middle, a resting cognitive state or a resting focus state. And so a lot of times with people with cognitive decline, Alzheimer's, you see a decrease in activity of all the brain waves. And if you have more of a decrease in alpha versus theta, then if you have more of a decrease in alpha over theta, then you have too much of this theta activity. This theta activity is slowing the brain down, not able to function as well. And so they saw a decrease in theta to alpha ratio, which either means the alpha went up or the theta went down. Either way, they saw improvements there in the brain oscillatory function, and therefore improvements in the ability to think for themselves, react, um, and complete daily activities. So if we kind of work through this paper here, one thing they used was the MOCA, the Montreal Cognitive Assessment Test, to look at cognition. And so this is a 30-point scale test. 30 points the best. You have to have under 26 to be considered cognitive declined. Um, there are some other things they pointed out here. That theta alpha ratio is a marker for Alzheimer's disease and cognitive impairment, and then it increases in patients with Alzheimer's disease. They looked at how they have more in the history of how exercise training is good for Alzheimer's disease. You can increase the hippocampus size. Hippocampus is where we convert short-term to long-term memory, and it can also increase brain neurogenesis, or making new cells. They also looked at how bouts of exercise can increase that beta oscillation, so increase brain waves in general, especially in the frontal regions. They saw again how exercise can be important for cognitive benefits. This is all part of the history, all part of their literature review. This one I thought was cool, the training with the eyes closed and remembering to do specific exercises with several stations. This has also been shown to have improvements in brain functioning, and eyes closed exercises can activate brain areas involved in memory and focus. They will also increase alpha and beta oscillations. So again, doing eyes closed activities, maybe with a cognitive task like counting backwards with numbers, or saying every word that starts with a specific letter, can all be beneficial. So like I said, here's the Montreal Cognitive Assessment. The maximum score for this test is 30. Score of 26 or higher is considered normal, so it has to be below 26. Other tests they did were for short-term memory, executive function. This test looks at short-term memory, executive function, with like trail making, clock drawing, attention working memory, language, naming, repetition, fluency. So tons of things are associated in this MoCA test. As I said, they did depression questionnaire. They did many other things. Okay, so then let's scroll down here. The functional test, like the timed up to go test. They did the EEG. Okay, so here's the training protocol. So they did this for 12 weeks. So it was twice a week for 12 weeks, or 24 total workouts. They were 40 to 60 minutes long. That included 10 minutes of warm up, 20 to 40 minutes of the main exercises, and 10 minutes of cool down. The simple brain activities were eyes closed training, cognitive activities, and physical activities like muscle endurance, balance, and aerobic capacity. There was a gradual increase in resistance with dumbbells and TheraBand. And they also had other obstacles with like sponge obstacles for balance, and then had to do this with eyes closed. They had a balance beam again with eyes closed. They had these different vowel stations, and so 6 vowel stations again with eyes closed activity. And then they also did a variety of other exercises like curls, hand raises, knee raises, lunges, different things like that can also be good for resistance and balance training. Okay. So I think we can go right down to this beautiful graph. Okay, so the absolute change in MoCA score, the training group over the control group, had a significant change in their total score of the MoCA, which is fantastic. Most of that came out of memory, execution or executive function, attention, which less came out of orientation, language, and abstraction on the MoCA test. Okay, they also showed right here that the brain oscillation rate, so the pre is the blue, the purple or the pinkish purple is the post, and then same thing here. The training group is the one on the left, and the control group is the one on the right. So there is an increase in brain oscillation overall in the training group, a slight to non-significant decrease in the control group. And then here, the theta alpha ratio significantly decreased in that training group. Again, meaning that either the theta decreased, which is good, we don't have as much theta slowing the brain down, or the alpha increased, again, increasing that overall activity in the brain so that we can have better cognitive function. And so lastly, they were able to train the heart rate to get higher and higher and higher with without overtaxing the individuals, which is also a fantastic property because I mean aerobic exercise got more robust as well. So basically, in conclusion, they showed that this 12-week combined balance, resistance with eyes closed, eyes open, and cognitive functioning protocol helped to improve Alzheimer's symptoms, helped to decrease depression in Alzheimer's disease. So that was a pretty quick paper, but it's a good one and it's a new one. And I just want to emphasize how important that is for people who are thinking they are becoming cognitive declined. If you have a loved one who you feel like is becoming more cognitively declined, get them out, get them walking, get them doing resistance exercise, get them doing balance training with eyes open, eyes closed, have them do other mental activities while they're doing physical activities. That ensures we're getting blood flow to the brain from two mechanisms, both by cognition and some sort of muscular activity. And so that's what we do a lot here with Alzheimer's patients, along with using many of our tools to stimulate the brain further. And obviously nutrition. Nutrition is very important in treating Alzheimer's, making sure that we get a good deep dive into labs and seeing if there are any toxins or infections that may be predisposing or a true cause to the Alzheimer's disease or dementia. So I hope you enjoyed this one. I hope you share this one with many others because more people need to know that there are non-pharmacological approaches to Alzheimer's that are generally more effective than those pharmaceuticals. So thank you again. I hope you have a great day and stay healthy.